Good afternoon. I'm speaking on effective communication, significance of effective communication during health education in nursing. This study contributes to the knowledge of nurses about communication. It's very vital and the landmark of any organization. Effective communication helps to improve quality of care given to patients and makes continuity in patient care more effective, and the community at large develop confidence in the profession, make early diagnosis easy, and promote the image of the medical field. The study also emphasized the importance of effective communication between nurses, patients, and other healthcare workers during health education, as it is very vital for client safety, disease, and curative health promotion. Nurses are also employed to learn good communication skills, as lack of guidelines for or if or formats may contribute to medical errors as a result of communication problems. The background of the study: communication, communication, which is a dynamic reciprocal process of sending and receiving messages, which is from the cry of a newborn to the whispering of a dying patient, has existed since the beginning of human in the transfer of information occurs at different levels in institutions, organizations, and fields in different ways and for most beings as well as certain machines. Communication as a study or discipline was formed on a special on communication as central of the human experience, which involves understanding how behave how people behave, exchanging and interpreting messages, the very basis for continuity of patient care and to learn and for teamwork among the staff. It is the exchange or sharing of information best between two or more persons. Research questions: can effective communication help to improve patient awareness of disease? Are the barriers to effective communication between nurse, patients, and other workers during health education? Are there various types of communication skills utilized by nurses during health education? Objective of the study: to ascertain the relevance of effective communication. To ascertain the effective communication in health education, to know the exist communication pattern between nurses, patients, and other healthcare workers during health education, to determine mechanisms that can be adopted by nursing and other healthcare workers to improve their communication, to discover the communication skills that will be useful by nurses and other healthcare teams to improve the patient's care. Method of the research. The research was designed study setting, target population, sample and sampling techniques, instruments developed, validity and reliability of instruments, method of data collection, data analysis, and ethical consideration. Research design. The research design adopted by the researcher was a non-experimental design. Research setting. The research was carried out among nurses in outpatient and other healthcare workers, mostly domestic staff in the Makangeni Health Center, Lagomesa, Chiseloni region. The hospital is located along the South Africa Express Road. The hospital was commissioned in 1992 as a 42-bedded ward and currently having a mini theater, public department, TB clinic for drug sensitivity and drug-resistant tuberculosis, art clinic for HIV and AIDS patients, and the Shisononi region is bounded by the Bondo region at the east, Mazini at the south, KwaZulu-Natal in South Africa at the north and west. It is said the hospital serves as one of the mother facilities for the baby clinics in the region and also receive patients from the regions of Swaziland and provinces in South Africa. It also serves as a clinic practice center for some student nurses in the neighboring school of nursing. Excuse me. Target population. The target population for the study comprises of the nurses, patients, and other healthcare worker providers. Sampling technique. The research the researcher adopted a non-probability coordinate sampling technique in selecting the participants for the study among the healthcare workers and patients in the outpatient department as part of the hospital as, as part of entry into the hospital. The sample size was based on the number of staff and patients seen during the review. Instruments for data collection. After an in-depth literature review, the research the, excuse me, the researcher designed a structured questionnaire. The consultant, the researcher designed a structured questionnaire. The researcher derived the questions from the literature review, from the researcher observation, and from the consultant, which was supervised with the supervisor. Excuse me. The questionnaire was made up of the introduction, demographic data and subject matter, validity and reliability. The instruments were developed initially by the researcher and were given to the supervisor preparation to ensure that it covers the scope of research to ensure the content, criteria and construct. A pilot study was conducted in the TB clinic and was found to be based on their responses. Method of data collection. The questionnaires were distributed to the subjects by the researcher after their consent had been taken, following a comprehensive briefing about the objective of the research. Enough time was given to enable respondents to complete the questionnaires before retrieving the completed questionnaires conveniently. Method of data analysis. Data was analyzed after they have been gathered. The descriptive type of statistics was used to summarize and describe the data collected. The, the gathered data were presented using frequency distribution table, percentage, pie charts, and histogram for easy understanding. Ethical consideration. The researcher introduced and explained the nature of the study and its purpose to the respondents. Approvals from subjects were sought before administering questionnaires. Columns for names, initials, address, and signatures were not provided in the instrument, thus ensuring privacy, anonymity, and confidentiality in every aspect. Data analysis of data. This presents the data analyzed and interpretation. The statistics are presented in frequency table, histogram, pie chart. A total of 100 questionnaires were distributed and were retrieved. The researcher collected data from the respondents using structured questionnaires, and findings are discussed in numerical sequence according to the format of the questions. Importance of the study. Effective communication is the backbone disseminating information to patients. Nurses create the vision, support the strategies, and the catalyst for developing the individual bench strength to improve the patient's quality care. Communication process allows us to interact with one another. Without it, we will be able to share knowledge and experience with anything outside ourselves. Communication is a part of everyday activities, and assumes no one that is why it is important to understand how to communicate effectively, especially first timers in the hospital, so as or to the community where there is disease outbreak. The study is aimed at understanding the significance and communications when giving health education in nursing. It is also aimed to find solutions to the factors responsible for ineffective communication, thereby creating a clear and open communication network between nurses, patients, and other healthcare workers. The research study will serve as a reference to other researchers on topic related. The scope of the study. The research study is limited to outpatient departments, nurses, and other healthcare workers of Matangani Health Center, Swaziland region, Southern African Development Commission. Limitation. Factors such as inadequate finance, academic activities, language barrier, and the time frame for this research tended to limit the study. Literature review. Definition of communication varies widely, but with similar ideas. Communication is the process of sending information, ideas, emotion, ability, and so on by that slowed down Stella 1964.
Hello,
Continue.
John. Can you hear me?
And down the line, nurses and doctors. Yes, I can hear you.
Hello, John. Okay,
Hello?
you're having only another 5 minutes. Please go through fast.
Hello? 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 Yes, pardon? Hello? Hello?
Hello, John. You're having only another 5 minutes. Go through fast.
Hello?
Please conclude on your presentation.
Hello?
Hello, John. Can you hear me?
Hello? Yes, I can hear you. What did you say?
You're having only another 3 minutes.
Hello?
Please conclude fast.
Okay. Summary of the study. Effective communication is the backbone of disseminating information to patients. Nurses create the vision, support, and strategies and are catalysts for developing individual bench strength and improve the patient's quality. Then down the line, we talk about the effective we talk about the studies which contribute to the knowledge of nurses about communication, as it is very vital and the landmark of any organization. Effective communication helps to improve quality of care given to patients and makes continuity in patient care more effective, and the communities at large develop confidence in the profession. Make early diagnosis easy and promote the image of the medical field. Also emphasize the importance of effective communication between nurses, patients, and other healthcare workers during health education, as it is very vital for safety, disease prevention, curative, and health promotion. The study contributes to knowledge of nurses about communication, as it is very sorry. This presentation was identified by some problems which will be attempted below. One of the problems is serial distortion. It can be semantic or poor construction. Semantic are distortion arising from using ambiguous words which convey different meanings. Example is gate and gate. But poor construction such as choice of words, lack of coherence, poor organization and structure of message, technical concepts. Then along the line, we talk about language barrier as one of the problems. This can be a hindrance, so the nurse should speak the language that the patient understands, like using their local dialect. In the case where the nurse does not understand the language, the use of a good interpreter will be employed. Wrong timing. Factual information should be timely disseminated. Message released at inappropriate time are ineffective. Then according to Harold Lasso 1948, a convenient way to describe an act of communication is to answer the following question. 1. Who refers to the communicator who formulates the message. 2. What is the content of the message. 3. Channel indicates the medium of transmission. 4. Who describe either an individual recipient or audience of mass communication. Effect is the outcome of message. The movement of the message travels from communicator to the audience. Method. Here these are done before. Research results and discussion. Question 1. Can effective communication help to improve the health education of patients? From table 4.8 and table 4.6, 96% of respondents indicated that communication aids cooperation during health education. All the respondents from the table 4.16 indicated that effective communication will bring about patient satisfaction. Maxfield 2005 stated that effective communication among health team members give a better outcome. Question 2. Are there barriers to effective communication between the nurse, patient, and other healthcare workers during education? From table 4.9, 84% of the respondents observed barrier in communication between the nurses and the patients. From table 4.10, barrier to effective communication amongst the community team was status ever. 52% workload, 18% nurse, 16% and individual barriers, 13%. Are the various types of communication skills utilized by the nurse and other healthcare workers during health education? From table 4.5, 56% of the respondents use verbal communication, 20% indicated non-verbal communication, 12% indicated written, and 16% use of all communication. From table 4.6, the various types of communication skills are used by both nurses and patients and other healthcare workers. 80% of the participants indicated that verbal communication is mostly used, while 20% indicated non-verbal communications. Significance of the study: Communication means good communication means good understanding of another and makes for good relationship. It is fundamental to the facility management to make it important at outpatient department because the nurse do most of the work in isolation, and since they must work with someone, they must communicate effectively and efficiently. To achieve organizational goals, there must be a good interpersonal relationship for smooth running of the clinics and success in achieving desired results in patients' medical care. Nurses and doctors who communicate effectively are better able to collect data for assessment and initiate intervention, evaluating outcome of intervention, initiate changes and promote health and prevent legal problems associated with medical practice. Huntington 2010. Strategies for ineffective communication: use feedback loop, simplifying the use of understandable language, listening attentively, constraining emotion, aligning verbal and non-verbal cues, training employees in relating communication techniques, developing the right attitude to communication techniques, setting appropriate machineries for communication. Maxfield et al. 2008 on a study titled Silent Speech showed that more than 60% of medical errors are caused by mistakes in interpersonal communication. How effective their conversations were related strongly to medical errors, client safety, quality of care, staff satisfaction, and turnover. The study showed that those
Hello.
healthcare workers who were confident in their communicating abilities to discuss their concern with other co-workers were satisfied and committed to staying in healthcare. My references
Hello,
were
Miss John Elizabeth. Can you
Alike
hear
JA
me?
27, Strength in Communication, Bama Solda Koza F 2008, Koza and F Foundation of Nursing, Concepts